Hi, and welcome to Spoonful of Strength. I'm Rachel, and I live with multiple sclerosis, type 1 diabetes, and a few other diagnoses that keep life interesting.
And I'm Tina. I am a fibromyalgia warrior with chronic back issues and a proud stage 4 cancer survivor. We're sisters, and together we're here to support, inspire, and connect. So if you're new here, the spoon theory explains how we navigate life with limited energy or spoons.
And we're thrilled to share that we've been ranked number 30 on FeedSpot's Top 100 Chronic Illness podcast list. So grab a spoon and let's dig into stories, tips, and a whole lot of strength. Welcome to another episode of Spoonful of Strength. This is a bonus episode that we have today, and we're really excited for this episode. Later in the episode, we are going to be talking with Tilly Rose, and she is somebody we had scheduled for our third season and was unable to get connected for season 3. And she is feeling good and ready to talk about her story. So we thought, let's just get a bonus episode here and get it out for you guys. We are also going to be talking about medical gaslighting, which from the Spoonies we've interviewed, we hear that quite a bit. So we're going to talk about that in the first part, and then we're going to get to Tilly and talk about her new book out called Be Patient. So Tina, I feel like we lied to everybody about, season 3, we did a big wrap up and everything. And here we are now. I guess we just can't step away, can we?
Nope, it's like a surprise for all of our listeners.
Yeah, there you go. They won't believe a word we say from now on.
Nope.
But no, this was an important person that we wanted to talk to, and we wanted to make sure that we were able to talk with her right when her book comes out, and it's just been out a few weeks, and so we're excited about that. But I guess by the time this airs, we've only been gone 2 weeks. So how have you been doing in the last 2 weeks?
Oh my gosh. The what's that saying? Grass not growing under your feet or something like that. There's some little old quote about that, or not about that. And I feel like that's how and I've just been so go lately.
Mm-hmm.
I need which is, I guess, good and bad, because I went so long with not being able to go anywhere when my back was so awful. So it's, kind of nice to be back in the swing of things. But I'm also, I need to find my balance on everything right now.
Mm-hmm.
But that's not going to happen anytime soon.
Yeah. You're busy.
How about you? I know.
Yeah.
Busy. Well, camping season, we got to go up and open our camper. So that actually, it's not even though I'll be gone every other weekend, it's a nice time to relax and renew versus being busy.
Yeah, I know how much you enjoy being out there. I've been trying to relax the last couple of weeks. We are going on vacation next week. It's the first vacation we've taken in about 7 years, and we're going to go out to Gatlinburg, Tennessee, and we've got a really nice cabin in the mountains, and it'll be my 3 boys who are all grown up, and my son's girlfriend, and we're just going to kind of take it easy. But I think we left the last episode with still not knowing about my muscle biopsy, and we did get the results back on that. And it looks like that it's something called centronuclear myopathy, which is a progressive muscle disorder. So after, what has it been, 7 years of tests showing weakness with the lungs and with multiple areas of weakness, we finally have an answer. So now I'm just in a place where it's not set in yet. I'm just kind of waiting and for an appointment in August to kind of let everything sink in and figure out. There's really no treatment or any cure. So it's just about, I've started back in physical therapy to help with some of the muscle stiffness and weakness and all of that. But at least many of you will know, when you've been dealing with something for so long, to get a diagnosis is kind of, you know, not that you want a diagnosis, but sometimes it can make you feel like, okay, well, at least you know what you're looking at. So,
Right.
and we're going to talk a little bit about medical gaslighting here in the first part. And there has been some gaslighting on the part of getting this figured out. So, we're going to talk a little bit about that. But Tina, let's start a little bit because medical gaslighting has been around for a while, but can you kind of explain, what medical gaslighting is?
Yeah, sure. There's so medical gaslighting, basically it happens when a provider kind of dismisses or minimizes or invalidates a patient's symptoms, often suggesting that it's all in their head or
Mm-hmm.
not that serious, without really bothering with the proper evaluation.
Mm-hmm.
You
Yeah.
know, maybe, people, we hear about so many people going in and saying, I knew something was wrong. And the doctors would say, oh, it's probably just because you've been stressed, or because, you're hormonal, or,
Mm-hmm.
um, you know, it's all in your head,
Mm-hmm.
or you're over worrying. Or the one thing that we hear a lot, stop diagnosing yourself, or stay off Google,
Right. Right.
um, those type of things.
Yeah. And I think another part of gaslighting, at least from what I've experienced, is, more recently with the muscle issues, when they first started appearing, they said, "Oh, it's just your MS." The pulmonologist said, "It's just your MS. You need to talk to your neurologist." Well, my neurologist said, "No, it has nothing to do with your MS." And in fact said, muscles don't have anything to do with MS. And if you even go on to the MS website, muscles, nerves, even though MS is a nerve disease, nerves control the muscles. And so it had made sense to me. And so I was like, okay, well, my neurologist is saying, no, it has nothing to do with it. And so that's why for many years it just went undiagnosed because I couldn't find anybody to help me. And in fact, I had genetic testing actually a year ago, and it showed that variance that I have. And my neurologist was like, "Oh, it came back normal." And I'm like, "Well, there was a variance in the neuromuscular panel. Like, what is that?" "Oh, it's nothing." Well, it took
Hmm.
a year for me to actually say, how can something come back abnormal and it be nothing? And
Right.
I wasn't given a real good explanation. And um, it took me reaching out to my general practitioner and finding another neurologist. And here we are a year later now with a diagnosis. And I feel like I'm probably going to be changing neurologists just because of always kind of
That
feeling
situation.
like they're not understanding, you know,
Hmm. They're
everything that's
discounting.
going on.
Yeah. Do you feel that sometimes the gaslighting happens because the doctors don't know, but they don't want to admit that they simply can't figure it out? So they're like, oh, well, if I can't figure this out as a medical professional, then it must be in your head.
I think a couple different things. I think they can definitely think that, but I think as a patient, I would rather hear, "I'm not sure what's going on. Let's see if we can get you to somebody who might find out." And that was one thing
Yeah.
that I was struggling with is they always just said, "It's not it's not because of MS," but they would never help me to get to somebody that might look, you know,
At
forward.
something else.
Yeah.
Yeah.
And the other part of it is sometimes I feel like, depending on how long the doctor has been in practice, that they can be set in their ways. And
Hmm.
me, myself, I am not a black and white patient. Not everything, even with my MS diagnosis, it took forever because not everything was purely blaringly obvious that it was MS. So, with the muscle disease now coming on, it was almost like, well, this isn't normal. And so I know better. And so it's nothing
Right.
because I have all this experience and it's not a black and white obvious case, then we're just gonna tell you everything's normal. And that's what I
Yeah.
didn't like is that when things, and I still to this day have blood work come back with oddities and they'll, oh, everything looks great, everything came back normal. And that can be really frustrating.
Yeah. Do you feel that um them kind of discounting that and not say, and instead of just saying, like you mentioned, I'm not really sure, let's maybe tap out or reach out to somebody that might be able to help you. Do you feel that you could have gotten this diagnosis sooner had they not had they been more proactive with stepping up to the plate to help figure it
Yeah, and
out?
I definitely, and I feel like even, my MS diagnosis, I had symptoms in 2009. I did not get diagnosed until 2016. And again, I was told, well, yeah, there's lesions on your brain, but we don't really think it's MS. And I think when you hear things over and over and over of your blood work's normal or we're not, this isn't MS and all of these things, you start to doubt yourself. And it
Yeah.
takes a strong person to be able to say, I mean, gosh, I've been dealing with the MS symptoms to 2009. It took until 2023 for me to say, okay, I've had enough of this. I'm going to
Mhm.
find another practitioner that is at least going to try and figure this out after
Right.
years of feeling like it was a struggle and it taking way too long. And I don't think that some people are strong enough to do that. Lord, I wasn't, it took me so many years to say, okay, well, I know this isn't normal. So let's let's try and find somebody else that maybe will give me a different opinion. That's hard to do.
Yeah. Yeah. There's for multiple reasons. One, I think especially the older generations and even us, we grew up with that mindset of the doctors did has gone through all this education.
Hmm.
They're the experts, so we listen to them and
Hmm.
don't question. But it's, I know we talk quite a bit about, and a lot of our spoonies talk about, needing to be your own advocate. Um, but it can be hard, especially when you are dealing with health issues and you're not feeling the greatest. Um, it's hard to stand up for yourself because it takes so much more energy to do that
Hmm.
when you're already depleted.
Yeah. And I think, as you said, we are used to growing up just trusting what the doctor said. Well, we have so much more information at our fingertips than we did, where we can go
Mhm.
on Google and say, these are my symptoms. I was able to, with my muscle biopsy report, this was after or before they sent it to Cleveland Clinic, I uploaded it into Chat GPT and said, okay, I don't understand this report. Tell me what it's saying. And I
Mhm.
was able to then go back to that after they came back and said it's probably centronuclear myopathy and say, okay, this is what the doctor's saying. And it was able to say, yes, based on this, this, and this seems like this is what it is, or most likely. And we didn't have all that information back then. And I think depending on the doctor, sometimes they can feel uh, like we're questioning their medical degree if
Yeah.
we push too hard, where in fact, we are the only ones that know how we feel. And it's about trusting your patient that, I mean, who would want to go in and say, "Oh, I want a diagnosis," but believing the patient when they're saying, "Okay, I'm having this, this, and this. Help me because I'm in pain so much," and um, so I can see a little bit of struggle with that as well. Um, did you ever have any issues as far as medical gaslighting or anything with your cancer or fibromyalgia or your back?
Originally I was like, I didn't think I ever, like, I know with the fibromyalgia, I feel like I actually had no pushback. They ruled out other things that could be tested for. And then when that came about, they're like, when all of that came back negative, for lupus and chronic fatigue and all of that, um, they were like, okay, it's fibromyalgia. They didn't question the pain and the aches and pains that I was going through. But I did realize that it happened to me, and I had talked about how I had dealt with colitis for a year due
Hmm.
to the Keytruda that I was on. And it took a year before my oncologist finally admitted that it was likely caused from the immunotherapy drug and put me on the steroid that I needed to control it. And the problem that I ran into, I was so frustrated because I knew, I had been on it for 4 years. I knew that that was a big possibility of a side effect, for with long-term use. Um, they kept treating me with prednisone, which I didn't like being on. I kept telling her I don't do well on prednisone. It affects it affects me too much mentally. Like it throws me
Hmm.
in a really, really bad, like manic depression, like a bad depression. And so I'm like, I don't like being on it. But there was another steroid that's actually specific for the gut, specifically to treat colitis. And she kept insisting that it was not colitis and or it was not, that was how they treat it. They treat it with prednisone, not the budesonide. And so I tried to trump her on that and went to a gastroenterologist. And I said, this is what I think, I'm pretty sure this is what's causing it. I just want to be prescribed budesonide instead of
Hmm.
prednisone because prednisone wasn't getting it in, like it was affecting me mentally and emotionally, but it wasn't helping the actual colitis.
Yeah.
And and then he wouldn't do it because he didn't want to go against the oncologist. He's
Mm.
like, I'm not going to change your medication. So that was very, very frustrating for me. I just felt I had dropped down even lower during that time. I couldn't eat. If
Mm.
I ate, if I had to go somewhere or if I was out and about or traveling, I would go all day without eating because as soon as I put food in my stomach, 10 minutes later, I could not be far from a bathroom. I mean, it was pretty severe. And I dropped down even lower than I did when I was on chemotherapy. Like
Mm.
I look at old pictures of myself from, around when was that? 2022, 20 into 21, 2021, 2022. And I just looked so, so unhealthy.
Hmm.
Um, I didn't realize how unhealthy I looked until I look at those pictures of it. And it was extremely frustrating.
Yeah. Yeah. And I feel like that some of the things that can happen, whether it be diagnosis or like you said, medication, things like that, and even how important the doctor's words are in the way that they talk to us, that can have a big mental impact on
Yeah.
on the patient. Gosh, I remember, years and years, and now looking back, I had had two relapses with MS, and I was like, why are they not like really considering this. And because of all the challenges of getting diagnosed with MS, it kind of brought back while I was working with, the muscle issues of is it all in my head? Is it just the MS? But what do you think the mental impact is on somebody who's hearing all the time some of these phrases that it's all in your head, it's everything's normal, and all of that, the impact of that?
I think it can definitely impact people mentally pretty severely. I mean, when you're already reaching out for help
Mm-hmm.
and a diagnosis, and you just want to at least know what's going on with you, and hopefully by it's something that some type of treatment can help, and then to be told that it's all in your head and there's nothing physically wrong, so we're not, go see a therapist instead. I mean, that's got to have an impact on, I mean, I hate to say it, but it's got to have an impact on like suicide rate and things.
Mm-hmm. And depression, and
And
you know
depression, severe depression. And
yeah,
yeah.
and even with people that have those invisible illnesses where maybe on the outside they don't look sick, and you make a doctor's appointment, which specialists can take 4, 6, 8 months to even get in. You've got a limited amount of time. You've gone all those 6 months with being in pain and having all of these symptoms. You only get a small amount of time, and you walk in there and they're like, no, I think you're good. It's a it's that can be devastating to feel
It's
like
a it's a
I
slap in
have
the face.
waited all and I'm in pain so much. And not only does he not think that there's anything wrong, but that I'm either imagining it, or I'm just going to have to live in this pain forever. And
Mhm.
um, just feeling almost like just not feeling heard, I think is the biggest thing. And you're exactly right with the mental health part. It's just there's so much more that goes on that people don't understand. And you're really putting your trust into not a doctor that's going to tell you what you want to hear, not a doctor who's just going to say, "Oh yeah, it's POTS," and not check it out, or whatever it might be, but somebody who actually listens and understands how much you're struggling with it, and is going to try to figure it out. And think some doctors sometimes won't order the test, or won't uh, prescribe anything. And it's like, why not order the MRI? Why not order the CT, or whatever, the tilt table test, or whatever it might be? We're the ones paying for it. We're the ones that are having to go through with the scan, or whatever it might be. Like, I just don't understand sometimes of just being like, it's nothing, and expect us to walk away and not have feelings about that.
Right,
Um,
right.
that's so hard. But
Yeah. And like you said, especially when to see a new specialist, you wait forever. And
oh
then,
yeah.
in the meantime, you're dealing with all of this. So you go in hopeful and almost like a sense of relief, saying, okay, I'm finally going to see somebody about this, and I'm finally going to be on, the right path forward. And then to go in and just be completely discounted,
Hmm.
is devastating.
Yeah. Yeah. So when we look at, I mean, you and I can sit here and complain all day, but I guess we should probably leave our listeners with maybe some advice or things that have worked for us. I mean, I talked about the second opinion that I reached out to, and I didn't even go through my neurologist because I didn't want to deal with the backlash of me saying, okay, well, send me to somebody else. So I went through my general practitioner and said, I'm just not getting anywhere, and went that route. And that's what has led me to um, getting the diagnosis. But there was a Spoonie, and gosh, I wish I could remember who exactly it was to give them credit because I thought this was brilliant. But she said to her doctor, I don't, something to the sort of, I don't think that you understand how much this is impacting me, or how I don't think you understand how how poorly I'm feeling. And I felt like
Mhm.
that was a really good sentence to say just so that
Yeah.
they can understand the impact. But hey, Spoonful of Strength listeners, I know we've talked about nutrition on the podcast. Well, we can't forget about our furry friends.
That's right, Rachel. Our pets deserve the same love and care when it comes to what they eat. That's why we're excited to tell you about Space Dog treats sold by my business, Magical Mutts Creations.
These treats are made with all natural ingredients crafted right here in the USA and free from unnecessary additives. My dogs love the Salmon Galaxy Bites. They do a happy dance every time they hear the bag crinkle.
Supporting Magical Mutts means supporting a chronic illness-owned business that truly cares. Treat your pup to healthy, nutritious snacks they'll love.
Visit magicalmuttscreations.com today and discover the magic.
Because our furry friends also deserve healthy treats.
What are some other things that you can think of?
One of them, I guess, would be like kind of goes all in. I think that some doctors they don't see you as they don't see you as a person. They see you as a patient. If that makes sense.
Yeah.
So like the Spoonie that said, I don't think you understand how this is impacting my life. So trying to make that connection of going, hello, I'm a human. This is my daily life. I'm putting my trust in you, and finding that help. But also, I feel like one thing that can help is turning to social media. And I know a lot of the medical professionals do not like that.
Mm-hmm.
They don't like, because I feel like there's doctors out there that you walk in there and you're like, hey, I was reading this on the internet and I know we haven't figured out what's going on, but could it possibly be this? And some of them will be like, yeah, you know what? I didn't think of that. Thank you so much. And other ones will roll their eyes and be like, stay off the internet and stop trying to self-diagnose.
Yeah.
But sharing your story out there with others who are living similar lives, you never know who's going to say, you know what, I had this exact same thing. Your doctors haven't thought of this yet. Have them check you for ABC, and that might help you get the answers in the treatment.
Yeah. And we'll find out when we talk to Tilly here in a few moments that her reaching out to social media was the turning point for her. But not only to get like ideas of what it could be, but also just to have somebody who you don't even know reach out and say, I'm sorry you're going through this, or,
Right.
I've experienced something like that, and just to feel heard, because when you're in that situation, you're not being heard. And
Yeah.
so and I also think that because you get such limited time with these practitioners, of making sure everything is documented. And I am a little bit crazy about that sometimes, but to go in, because what you don't want to ask, or what you don't want to hear, is them saying, well, when does this pain happen? Do you have it after you eat? Do you have it at night? Do you have it this or that? And to not have that answer, because you probably are not going to see them for another 6 months, of making sure that you're documenting the symptoms and trying to put the pieces together. There's so many apps out there that will help you with that, but also just bringing somebody with you. Because I think there was one time, and Ed, he's not a big one to speak up, but we were talking and I was getting emotional because I was like, this is getting really hard to do. I'm having a hard time. And he was like, listen, I'm looking at her, I'm seeing her get worse.
Right.
And so this is not, she used to be able to do XYZ, and now she's having problems. And I can see this is affecting her a lot more. And especially with my cognitive issues, it's Ed is the one that will tell me, hey, I've noticed you're having a little bit more problems because I don't sometimes realize that's happening. But that's also a
Right.
really good one. And of course,
Yes.
any support groups and things like that are going to be really, really important as well. Do you have any lasting words of encouragement or anything to share with those people that feel like they're just stuck and can't move as quickly as they want to a diagnosis?
I think one of the important things to know is that you're not alone.
Mm-hmm.
And because when you do walk out of that doctor's office and you didn't, you feel like you've been kind of dismissed, that can be a pretty lonely feeling.
Mm-hmm.
So, and as you mentioned, like the importance of support groups as well, is that just remember that that's just one person and that's just
Mm-hmm.
one person's opinion. And you have a huge support staff. You have a huge support with us
Yeah.
here at Spoonful. And that's the purpose. One of the purposes that one of our missions, one of our goals is to just help people not feel alone in this journey.
Mm-hmm.
And if you do find yourself feeling that way, find somebody to reach out to.
Yeah. Yeah. And you're right. I mean, I think I don't know of very many people that we've spoken with that went in and got their diagnosis, really quickly. I've heard 10 years, I've heard 14 years.
Mm-hmm.
Me myself was, 7 years on both of my diagnoses. And you're right, it can be very isolating. And um And I think just from my experience, don't be afraid to ask for a test. Don't be afraid to say, I don't think you understand. Don't be afraid to get that second opinion or third or fourth. And just, yeah, I mean, we are here for um, our Spoonies to share their voices and share their stories and um, find the people that love you and support you and reach out to the people in the chronic illness community. They're the best people to talk to when you're having a rough day because we've all been through something similar, even if we don't have the same diagnosis. So
Yep.
I think this was an important episode to have. I think,
Mm-hmm.
especially with our guest coming up, Tilly.
Yes. Yeah. Yeah.
And
Yep.
we're so excited to bring her in. Tilly comes from across the pond, but um, her experiences, I'm sure, can be related. Many of us can relate to. So, just to tell you a little bit about Tilly before we bring her in, Tilly is a writer, advocate, and author of her memoir, Be Patient. So, she spent more than 20 years in and out of hospitals as a self described medical mystery. She finally received her diagnosis, including Addison's disease, hypermobile, Ehlers-Danlos, and more. And we both have gotten a chance to review her book. And her book is pretty much all about survival, misdiagnosis, chaos, and holding on to hope when the system fails. And she is using her voice to spark change in healthcare and speak up for patients everywhere. So I think I've said it 5 times today, but I really am so excited to bring her in.
I
Um,
know I'm so happy that we finally were able to connect because she just it's amazing and this new book that came out, it's just I'm so happy to have her as a guest.
yeah. Not only does she have a great, horrific, struggling story that we can probably all relate to. But she's also uplifting, and the way that she writes is just beautiful. And so she has a lot to share with being an advocate and supporting those with chronic illness as well. So let's bring her in. You ready?
Yep, absolutely.
Awesome.
We are super excited this week to welcome Tilly Rose on our podcast as our Spoonie, and she is an author, a chronic illness warrior, and has some great story to share and to talk about her book. So we're really excited. Thank you so much for joining us, and we're glad that we're finally we were able to connect, and the stars aligned where it worked out for all of us to meet.
Thank you so much for having me on. I'm really excited to talk to you. And as I say, what you're doing with your podcast is hugely valuable for the chronic illness community. So yeah, I'm looking forward to sharing my story.
So before we dive into your book, would you tell us a little bit about yourself? Just introduce yourself to our listeners, anything that you might want to share.
So yeah, my name is Tilly, and as you said, I am recently, as of only a few weeks ago, I have brought out my first memoir, Be Patient, which is about my 20 years struggle to search for a diagnosis and life behind the hospital curtain, which I have sadly become over the last 20 years, the expert that nobody wants to be, the expert patient, which I know you guys can sadly relate to. And along the way, yeah, although the patient side of things has in many ways ended up defining what I'm doing now, I like to think that there are lots of other facets to my identity as well. I'm passionate about reading and writing. Despite being told that I should give up with my studies and not do my GCSEs, not apply to university, I had a goal from a very young age that I wanted to go to Oxford University. And throughout all of my health struggles, and despite everybody saying that it wasn't realistic, that was something that I held on to, and something I believe when you have a chronic illness, having a goal and having a distraction outside of it, if it is possible, I found to be so important. And for me, that goal was Oxford, and that was something that I managed to achieve. So I went on to study English literature and language at Jesus College, Oxford University. And sadly, after I graduated, my health continued to deteriorate. And I guess that's when, in a way, the patient side of my life started to take over even more. And when I was at university, I was very determined to hide my situation from everybody around me. I really just wanted to be known as Tilly, not Tilly the patient. But over time, I began to realize, which we touched on when we were just talking earlier, that actually people can't have an understanding of what you're going through if you never let them in. And slowly over time, I began to, I guess, embrace that side of me a little bit more and allow more people in to understand that part of my life. And I'll go into maybe more detail on how that came about through social media later. But initially, that eventually led to me becoming an advocate for patients and launching a platform called That Patient Collective, which is a platform where patients can share their stories and also put out to the world options and ideas if they're searching for a diagnosis. So this patient side of my life has definitely come to the forefront in recent years in a way that I really didn't want it to begin with. But now I think has become one of the best things I've ever done, embracing this side of my life and also validating and acknowledging what other people and other patients are going through.
Do you feel that once you reach that point of actually embracing and being more open about it, that it made maneuvering through life with it a little bit easier?
Yeah, I think so. I don't know how you guys initially sort of first navigated getting your diagnosis and when you first became unwell, but I definitely found myself living what I would call a double life. I was very much intent on trying to hold on to this semblance of normality and this normal life that I so desperately wanted to be living, that I ended up performing my way through life in many ways, particularly whilst at university, because I was so intent on not being labelled. And I think with that comes absolute exhaustion at having to keep up this act. And when I eventually did let people in and began to share my story, I was no longer having to pretend. And there was something that was quite liberating about that. And it also allowed me to see that I had this perception that I was the only person going through this, which looking back is crazy. Of course I wasn't. But actually hearing other people's stories, particularly through social media, and hearing some of the absolute horror stories of what other people have gone through, are still going through, made me realize that actually, far from this being just my story in isolation, there are millions and millions of people having to navigate patient life, and mine was just one story to tell amongst so many.
Mm-hmm. And can we go back for 1 second and explain to us what the complex chronic illness is that you have?
Of course. So I first became unwell when I was 10 years old with what initially we just thought was a burst appendix. Appendicitis is something, many children get. And at the time, I thought that was going to be one hospital admission that was unfortunate and unlucky. But actually, the same year, I started to become very seriously ill with pneumonias. And then age 16, I had an emergency bowel resection. And throughout my teenage years, I began to develop a plethora of unexplained symptoms. And I was passed from ologist to ologist, I say like a hot potato, like everyone was looking at different parts of my body, which I think a lot of people with chronic illness can probably relate to, but nobody was looking at the whole picture and drawing all those different parts together. And more parts of my body were failing, but nobody could find one condition that sort of explained everything that was happening to me. And it was when I was at university that I finally, 13 years on, got my diagnosis, and I found out that I'd been living with 13 years of undiagnosed active tuberculosis, which was derived from drinking unpasteurized milk on my great aunt's dairy farm when I was 5 years old. And it had basically caused absolute havoc in my body. And I then had to undergo 18 months of chemotherapy and antibiotic treatment to treat that. And it was a weird mixture of this, fear and terror at the thought of this word tuberculosis, which also comes with a certain stigma. Mine wasn't infectious, but obviously in lots of cases it can be. And also a massive relief at finally having a label and something to treat and to understand what had been happening to me. And that was meant to be the happy ending. And I was very much hoping I'd get my life back. And for a short period of time, I did. My life transformed and I got a semblance of normality again after so many years of being very seriously unwell. But then sadly, my health then began to deteriorate again. And I was subsequently diagnosed with Addison's disease, which is where the adrenal glands in the body don't produce cortisol, and cortisol is needed for every organ in the body to function. And I was told that I would be steroid dependent for the rest of my life and had to carry an emergency life-saving steroid injection that I would have to inject if I started to go into adrenal crisis. And I was then again told, if you take your steroids, you should be able to live a relatively normal life. And that's what I was once again striving for. But sadly, the same pattern then emerged again, where things began to deteriorate. And that ultimately culminated in a 3-month admission in 2022 to a London hospital, where I lived on the open ward in my blue box, as I call it, for almost 3 months. And I was having, again, so many unexplained symptoms, one of which that became particularly traumatic and acute were these seizure convulsion-like episodes, which were happening up to 4 times a day that nobody could explain. And at that point in my journey, I was about to be discharged home on what they called comfort care, which was effectively palliative care. Nobody could work out what was wrong with me, and they didn't have any treatments that they could offer me. And it was at that point in my journey that I decided I had nothing to lose by posting on my Instagram and asking the world if the world had any ideas. And the world answered. And that was ultimately what led to my final diagnosis, which sort of underpinned all of this. And in November 2023, led to me boarding a plane to Germany, where I received a diagnosis of multiple vascular compressions, which is where the blood vessels in your body are squashed and the blood can't flow to the organs. And I found out in Germany that this was underpinned by underlying Ehlers-Danlos Syndrome, which is where the connective tissue in your body is too stretchy. And this ultimately actually connected all of my diagnosis, because Ehlers-Danlos was the underlying diagnosis. And if somebody with Ehlers-Danlos loses a significant amount of weight, which I did when I had tuberculosis, things in the body can end up shifting and stretching into the wrong places. And that's what happened to me. So vascular compressions developed, which went undetected for years. My adrenal glands weren't receiving the blood flow because of the vascular compressions. And the weight loss from the tuberculosis was ultimately what led these vascular compressions to come about in the first place. So it was this, as I say, imperfect, perfect storm of all of these symptoms and problems in my body, which sort of came together because of one underlying diagnosis that then led to a domino effect of all of these other things that happened. So it seems unique to me, but is, I guess, something that in many ways could happen to anyone.
Mm-hmm.
How were you feeling mentally throughout all of this, with as the diagnosis came, as you started getting, once you started sharing on Instagram and social media and had others lighting perhaps what ended up being the correct pathway?
Yeah, I think putting it on social media turned out to be the best thing I ever did. I think social media gets a lot of bad press, but this was a real example of social media for social good, really, in that I posted on Instagram in absolute desperation, and I received messages from professors, PhD students, doctors, patients, their families. And for us, it really restored our faith in human beings, really. We were in this dreadful situation in this hospital admission where nobody could work out what was wrong with me. And suddenly the world was answering with all of these suggestions. And my mum spent the next year working her way through every single suggestion on that list and desperately researching. But what it did is it opened up healthcare on a global scale. And actually, when you're stuck in a little ward in a little hospital, you only have the expertise of those people around you. And it really showed me that if we could have those conversations globally and healthcare could be opened up for patients to have this global conversation, I think the routes for diagnosis and actually finding answers, there are so many more routes and so many more options available if we're not just confined to our one hospital in our one area in our one country. And yeah, it massively, massively restored our faith in humans, really. It was incredible.
That is amazing. That is amazing. You're right. Sometimes social media can get a bad rap, but really to have people, I feel like the chronic illness community, we're all just about helping others and supporting others. And it's really become an amazing thing that has transpired, even, with us only being in that space for a year. But I do want to talk about your book. So during your experiences in the hospital, you kept notes of your experiences and ended up writing a book called Be Patient, which is out now, and we will supply the link for that book. And you detailed the struggles that you had with the medical diagnosis and treatment. What made you decide to start taking notes and write the book that we have now?
Yeah, the book has been something good that has really come out of this. And initially, as you say, I would lie in my hospital bed writing effectively a diary. And I guess for me, it was writing's always been a way of sort of getting things off my chest. And it was very cathartic to write down the different things that were happening to me. And as I say, day one, I wasn't very good at talking about it with my friends and people around me. So I guess it was my way of coping with it, really. But what came out of this was all of these observational anecdotes of life behind the hospital curtain. And there were moments of absolute trauma, upset, heartbreak. But as you guys will no doubt have seen yourselves, we also find humor in these very dark, challenging situations. And there was this roller coaster of emotions that I was witnessing. And I then read, it was actually during an admission during COVID when I was in the hospital wards. I was there for a month by myself. And I'd read Adam Kay's book, This Is Going to Hurt, which is a book by a junior doctor about his version of life behind the hospital curtain, but from a doctor's perspective. And I remember reading it and thinking, there has to be a reply to this from a patient point of view. And I'd read various medical memoirs on sort of specific diagnosis and illnesses, but what I hadn't read was anything giving that entire patient experience, from sort of the morning ward round, the medication round, the tests and procedures, what you observe on the wards, as more of a generic overview of what it is actually like to be a patient behind the hospital curtain. And yeah, I basically wrote this, I guess, in a way as a reply to Adam Kay, as this is the patient side of things. And my memoir takes you through my various searches for a diagnosis, but because I was this medical mystery, I was actually going through every single department in the hospital, every single test, every single procedure in an effort to find my answer. And it really meant I became what I would say the expert nobody wants to be, the expert patient, but that gave me the credentials to write this and to put all of my diary entries into what is now this book, Be Patient, that in the last few weeks I've very excitingly just been able to share with the world.
Brilliant.
Wonderful. Yeah, wonderful. So throughout your book, it sounds like there are quite a few occurrences where you were dealing with staffing shortages and cleanliness within the hospitals. What are some of the things that you encountered?
Yeah, there are. Sadly, what my book does is, as I say, it's observational. It shows what goes on, and it shows the human beings at the center of this story. So it shows what it's like for the patient. It also shows what it's like for the staff. And I think sadly what I've observed is a system in the UK, but also through speaking to patients all around the world, I've seen that the problems that I've witnessed in our system are the same problems that are happening everywhere. And there are instances where, for instance, on the 3-month London hospital admission, I would witness staff coming to clean the wards, cleaners who had no cleaning products. So I was there for a month at one point, and the area around my bed was never cleaned. There were bedpans piling up by the sink. There were terrible instances where I'd have doctors and nurses crying on the wards because they were so understaffed and they couldn't get around all of the patients. There were patients, there was a terrible occurrence of a patient in the next bed who was dying. And I think you have this, or people who maybe haven't been exposed to the healthcare system and on these wards have this belief or this understanding that there would be that dignity of somebody being taken to a separate room and have that time with their family. And actually what I witnessed was all of these things are just happening around you. And as a patient, it's not just about the medical treatment and the procedures. It's this sort of social experiment that you've almost been thrown into, and all of the emotions that go with that. And you're seeing these humans at the most vulnerable time in their life, when you're also at your most vulnerable, and there's no escaping. I say that the doctor can come on the morning ward round and these terrible things can sort of be happening on the wards, but at least at the end of the day, they can go home. Whereas as a patient, you're stuck there. And I think that's what really kind of hit home to me, that you're trapped in this setting. You have absolutely no choice over being ill. You are very ill. And then you're being exposed to these things that day to day, if we were being exposed to someone passing away next to us, there'd be this huge acknowledgement and this understanding for that. But there seems to almost be this view, oh, you're in hospital. It's okay. That happened in a hospital. And I think what my book tries to show is that there's that human side that still needs acknowledging.
Hi, this is Rachel from Spoonful of Strength. My Etsy shop is a chronic illness-owned business where I design t-shirts, hoodies, mugs, magnets, and more, all with a focus on chronic illness empowerment. Whether you're looking for something cozy, funny, or inspiring, I've got you covered. I also take custom orders because your story deserves to shine. Visit spoonfulofstrength.etsy.com, that's spoonful with 2 L's, and enjoy 25% off your order with the code podcast at checkout. Let's wear our strength with pride, one design at a time. Gosh, there's countless stories. I could go on and on and on about some of the stories that you speak about in your book, from getting unnecessary testing because of an error in communication. I think you said loin pain. They thought you said groin pain.
Yeah.
And, sitting in a corridor for hours due to overcrowding, and even a steroid that was removed that caused you to have terrifying hallucinations and things like that. So do those memories still haunt you?
I think because I have had, sadly, such a long trajectory of being a patient, and I think people with chronic illnesses and long-standing illnesses will probably be able to relate to this, there almost hasn't been time to dwell and keep reflecting on these, what, as you say, are some pretty horrific moments in the past, because I've always had to be prepared to move on to the next absolute shocker that's coming around the corner. And it's almost a case of, I would say, for the last 20 years, almost being in survival mode. There hasn't been time to dwell and reflect and actually almost process all of these things. It's been a case of, right, okay, that's happened now. But as you say, you've had the mess up with the procedure, but then the next day, actually, the steroids are removed and there's this terrifying night of psychosis. There's no time to then almost look back. And I guess part of writing the book has allowed me to do that. It's allowed me to get some of these thoughts and feelings onto the page, and I've been able to appreciate the funny moments, as you say, the giant pole shoved inside of me that was because they misunderstood loin and groin pain on the notes. So you've got the kind of humorous moments like that that you do have to look back on and just laugh. But then there were, of course, the super traumatic moments, like, for instance, that you touched on, the night where I experienced psychosis because one of these life-saving medications was removed. And writing that bit of the book was probably one of the first times that I'd properly really processed what had gone on that night. Because on the admission itself, as I said, it was just a case of surviving and getting through and carrying on. And sometimes survival mode, I don't think, leaves room for that reflection, but the book has allowed me to do that.
What's one moment throughout this whole medical journey that still makes you emotional today? Or is there a single moment that makes you emotional?
I mean, of course there are several, but I think probably one of the moments that always stays with me is when I was being discharged on that London hospital admission, and I was being told that there was nothing that anybody could do for me. And that has to have been the lowest point in my journey. My mum, who is my absolute rock and has made finding my diagnosis, supporting me, her absolute life's work, I think that was the one night where even she had no words. And for me, without my mum having a plan, it felt like things were absolutely hopeless, because along the way, I guess my coping mechanism had been, she'd always said, no, we've always got a next step, we've always got a plan. And for me, patient life, my way of coping has been having a plan, but without knowing what that short-term or longer-term plan was, and feeling that there wasn't anything, that really left me in a position where, I felt on my absolute most hopeless, and is a feeling that will stay with me forever. And what I would say with that to other patients, if you find yourself in that position, my mum's line is, there is always something else. And that doesn't mean that there's always a cure or there's always a treatment, but there is always something else, whether that be contacting a new doctor, whether that be supporting with a new symptom, whether it be planning what you're going to do that next day just to get through. That phrase, there is always something else, has got me through, and it's allowed me to keep holding on even when things have felt completely futile and hopeless.
Do you ever look back and think about what if I had just gone into palliative care and just stopped? Where would you be right now? Do you ever have those thoughts?
I try not to think about that because so much has happened since those
Hmm.
words were said to me that have really made me see that actually it would have been it would have been wrong to have almost believed that that was the only option at that point available to me in the wake of not having a diagnosis. I think it's very
Hmm.
different if somebody is saying to you, this is what we found, and at this point, this is now all we can offer you. But nobody actually was giving me a label or a diagnosis to say how they could justify this idea of palliative or comfort care. So it wasn't a case of me not being willing to sort of accept that. It was that actually they weren't giving me a reason to accept it. So in the wake of still not actually knowing what was wrong with me, I felt there was still hope and there were still options out there. And it turned out I was right to believe that because there were options. I went on to have 3 life-saving surgeries in Germany, which fixed fundamental structural problems in my body. And it's something sadly that I've seen. I've met a lot of particularly young women who suffer from Ehlers-Danlos syndrome whilst I've been over in Germany. And so many of them were given the same words really in their own countries. I've met young women from the US, New Zealand, Australia, which we would in many ways believe had advanced healthcare systems, and yet they've been told there's nothing we can do for you. Many of these women have been on feeding tubes, unable to eat. Some of them have been starving to death, and they've come over to Germany and had this operation that I've had, and they've been given their second chance in life. So I'd say what it has taught me is that there often are still options out there. It's a case of knowing about them. It's a case of conversing with other patients. And I think patients and the patient community, as you said, can be absolutely incredible. And the kindness that other patients have shown, but also the knowledge that they have that when you're a chronic illness patient, the amount of kind of self advocacy and research that you have to do for yourself means that the knowledge they actually have and their families have is invaluable. And the sharing of that knowledge really can save lives. And that's been proven with my case and many others.
Hmm.
So after going through all of this and getting your surgeries, your treatments, the initial diagnosis, how does all of this affect your day-to-day life now?
Well, yeah, so I've had my surgeries, which were really successful, which is amazing. And we've ticked off, I guess it's been a case of ticking off layers. And that's one of the really difficult things with having a chronic illness. I think you have this dream that you kind of get a label, you get a diagnosis, you get this, I don't know, surgery or treatment that fixes everything. And sadly, chronic illness, I've learned the hard way, doesn't work like that because a lot of these things, they do long-term damage to your body when you haven't had that diagnosis for so many years. And sadly, these vascular compressions have knocked out all sorts of other systems in my body, such as my endocrine system, which that's the next stage of trying to get on top of with my adrenal glands and my Addison's disease. So it hasn't been a case of just one surgery fixing all, which is what I would have loved to have believed day one. So my day-to-day life is still impacted by chronic illness and does still have to be managed in a way that a healthy person's doesn't. But I would say what I have now is a plan. I have a team who know my case really well, who know me as a person really well. And that has been absolutely game changing in terms of getting through each day and also the longer term trajectory. And I think I I have people around me now who know me as Tilly, not just the patient. And I think I hear a lot from chronic illness patients that when the doctors kind of stop seeing you as that person and just start seeing you as another patient on their ward round or another patient they're passing on to another department, it becomes so much harder to cope with day to day. But when you have people fighting for you in your corner, my day to day has become so much easier as a result of that. And I think hope is a massive part of that.
Hmm. I love your attitude. I
Mhm.
think one of the things that that I love is earlier um, in our discussion, you said writing your book has been your something good. And what I'm realizing is that you've reached out to others for help, and now you have people that are following you and following your story and realizing, you know, you you are the something good for others. I think is just amazing. I just, you know, I know you have a quite a bit of following on Instagram, and for you to reach out first and then now you're getting all these people who love and support you is just amazing.
Well, that's really lovely of you to say. And it has been, it's been hugely heartwarming to see now the messages, as you say, that I reached out on Instagram and these people helped me. And now I am inundated with messages from people from all over the world, um, many of whom have ended up going on to receive their diagnosis as a result of following my story. And that doesn't mean they've got the same diagnosis as me, but it's meant that they have almost had the willpower and the the willpower to think that actually no, they're not just accepting this as their life, that they are going to pursue this and they are going to, I guess, research and gain that knowledge to be able to ask the doctors those questions and to question the things that they're told. And that's been a big part of my story, has been questioning along the way. And I think you can't always question if you don't have that knowledge to question. And I've been incredibly lucky to have so much support around me, and I'm completely appreciate that's not something that everybody has. But I hope that by using my platform in this way, it is in a way validating, acknowledging, and giving other patients the confidence to question their own situations, or to ask the doctor about that other treatment that they've read about. And yeah, I think having that kind of confidence behind them is key. And it's really lovely to hear that that's ended up in some really positive outcomes for other patients as well.
And your book, Be Patient, it's such this powerful memoir of the mix of humor and heartbreak and everything that you have gone through. If your younger self could go back and read this book, what would you hope she would feel?
And that's a really good question. Yeah, I think that you're right. It completely shows the roller coaster that is patient life. I think she'd be a little shocked by how things turned out. I don't think I sometimes say, if I'd have gone back and known what I know now, I don't know how I would have coped. And maybe in that way, sometimes it's better not to know what's around the corner, because yeah, the book is full of some absolute shockers. And as I say, you think you kind of I think I've ticked off one thing, and then comes along the next thing and the next thing, and it feels like this sort of never-ending battle. But I think I'd like to think that, yeah, looking back, she would be proud of how I have continued to navigate it, and what it's ultimately, that this story that has now been shared with the world, that I think is a story that needs to be shared. And I think that patients are a group in society that I don't believe are getting the acknowledgement of what they're having to go through, particularly chronic illness patients on a daily basis, of the struggle of just getting out of bed every morning and facing the day, and the things that they're having to navigate in a day that other people aren't even having to consider or think about, from arranging their appointments to collecting their prescriptions to navigating travel to care, to whether or not they can manage to work, all of these things, that to go into socials, whether or not they'll be able to go, to the guilt that comes with that of having to let people down, all of these feelings, all of these emotions, and all of these practical day-to-day parts of life that I think patients are having to just get on with. And I hope what my book does is validate what they're going through and allows them to be seen in a way that, yeah, I don't think much out there at the moment is doing that. And it's been really incredible to hear the feedback from particularly from patients who have read my book, and also from people who are healthy, who have read it, and it has opened their eyes to this other side of life. So I hope that it kind of works on those two fronts. And what I always say is that whilst some of us with chronic illnesses and with diagnosis may deem ourselves to be patients, the reality is every single person on this earth will at some point in their life be a patient, whether that be just going to a GP appointment or sadly ending up in a hospital, and whether that be ending up in hospital for 24 hours or ending up there for a month. At some point in our lives, we will all be patients, or someone we love will be a patient. And in that respect, I feel that patient life, knowing about it, learning about it, having the practical kind of survival tips that I share in my book for getting through it, I think that they're things that we all need to be invested in, because it's not as simple as saying, oh, that won't happen to me or that won't touch me, because actually at some point in our lives, we will all be patients. So it's relevant to everybody, I feel.
Because I can only imagine how healing writing this book was for you. How does that feel to be able to go out right now on all of these platforms that you mentioned and see you published as an author?
It feels surreal. It feels, as I said earlier, it feels like my something good out of something bad. And it's been a 20-year battle. But having this book as having Be Patient as my goal, as my distraction, and now as my something good out of this something really, really bad, that the feedback is that it is helping and supporting other people. And of course, as you say, it's been cathartic and healing for me in its own way. It has to be a good thing. These terrible experiences have gone into something that I really hope now, my aim with this is, my much wider mission is to impact patient care and is to change things for other patients. And that word care, what does care look like? What does care mean? I want to change the system. My dream would be for Be Patient to be on the medical curriculums, so medical staff have an understanding of what the patient on the other side of the hospital curtain is going through. And this book is now part of my wider mission to impact patient care on a much, much broader scale. And yeah, I want patients to be at the core of those policymakers. I want them to be on the boards advocating with the people who are making the decisions about our hospitals. And I hope that this can play into a much bigger picture.
Can you share with our listeners where they can find your book, where they can follow your journey on social media or through websites, and then anything else that you might want to leave our listeners with?
Yes, of course. So your worldwide audience can purchase Be Patient from Blackwell's, which provides free worldwide shipping. And then it's also across all of the UK sites, such as Amazon UK, Waterstones, and there are also specific websites for people in New Zealand and Australia, which can be found in my Instagram bio. And my Instagram is @thattillyrose. And on my Instagram, I share chapters of patient life as it continues to unfold. I share it's almost like a narrative that's unfolding in front of people's very eyes still in real time as my patient journey continues. So they can follow there. And I also have a platform, which I touched on earlier, called @thatpatient collective, which was inspired by my own journey and is a platform for other patients to share their stories. And on that, we also share Instagram stories where if you're searching for a diagnosis or some support or ideas for treatment, we put it out there to our patient community and ask the patient community if they have any ideas. And people can submit their queries on our website, www.thatpatientcollective.com. So if you're a patient that's searching, then do take a look there. And as you say, the book Be Patient it's a validation, I hope, of what all patients are going through. And if you're a patient listening to this, then my message would be, my big message that is at the core of Be Patient is to hold on. And I hope that reading my book can give you that hope and that acknowledgement and that validation of what you're going through, and also just be relatable in a way that sometimes chronic illness life can feel isolating. But I think that if you're going through this chronic illness life which Rachel and Tina, sadly, I know you've both experienced far too much. But what my book, I hope, does is provide these relatable anecdotes that, as a patient, you can feel, you can relate to because you have experienced, and someone is acknowledging what you're going through on a day-to-day basis. And though my diagnosis may seem unique to me, that general patient experience that is at the core of this, and that human story of patient life is about all of you as well.
Mm-hmm. Well, you are definitely making a difference, and you, I'm just so excited that we got a chance to talk with you today. I've been looking forward to this, and your book is just amazing. For our listeners, go out and get a copy. It's a must read, to be honest. So you're making a difference, and I'm just so excited for the things that are coming even further in your future. So we can't thank you enough for taking time out, especially with chronic illness. I know how it can affect your day to sit with us for a half hour or so and everything. And so we just can't tell you how much we appreciate everything that you've given us today. And we have nothing but the best wishes for you in your future, and hope that we can be there to experience it with you.
Well, thank you so much, Rachel and Tina, and equally what you're doing with this podcast to raise awareness, and given your own health situations really is incredible. And it's, so valuable to the chronic illness community. So thank you for having me on. Thank you for allowing me to share my story. And thank you for all you're doing to raise awareness about these really important topics.
Oh, thank you so much.
Thank you.
Take care of your. I'm on your Instagram every day looking, and I love your chapters that you post.
It continues. Yeah. What we want is the Instagram to become really boring and no more patient life.
That's
that would be really nice.
That's right.
That's what I'm dreaming of. It'd be quite nice to not have any, shocking or particularly riveting chapters to write anymore. Ordinary life is what I'm dreaming of. So let's look forward to the boring chapters.
I would love to have a chapter of like, sorry, I haven't been on here for 2 weeks. I've just been relaxing in the sun and
just reading my book, having a coffee, and loving life.
Exactly.
Yes,
absolutely.
That's
what I dream of for all of us.
I am so glad that we took the time to surprise all our listeners with a middle of our break extra episode with Tilly.
Yeah. What I mean, I say this every time, but it's just so amazing to hear stories, and especially the people that we've been able to hear their stories outside of the US, and just how different things are. But I feel like her book is just so unique in the fact that it's just some of the stories in there just break your heart, and she is definitely a tough cookie, just a strong woman, that all that she has been through. And you talk to her and she's just a bright light of positivity. And with everything she's gone through, that's amazing to have somebody that can still have such a bright light after going through what she's gone through.
Oh, yes, absolutely. Absolutely. That was so enjoyable. I highly recommend all our listeners to grab her book and have a read, because she did a fantastic job with that. And we will be, so for real this time, this is our the final episode of season 3, and we will be back for season 4. We'll be announcing those dates very soon.
Yep. On Instagram, we'll announce when we're coming back, but we are taking time for ourselves and self-care and making sure that we're refreshed and ready to go to bring you season 4, so that we can really bring out the best guest and the best topics, and be able to be refreshed. So I'm looking forward to that. But what a great episode to end season 3, and I'm just excited for what is coming in store. Don't forget, if you don't follow us on Instagram, to give us a follow at Spoonful of Strength. That's Spoonful with 2 L's. That's where we'll update with the podcast, and any news and positive posts and relatable posts. And so if you don't give us a follow, please do so. We look forward to continuing to keep up with our chronic illness Spoonies.
Take care, and we will see you at the beginning of season 4.
Thanks for tuning in to this episode of Spoonful of Strength. We hope that you found a little inspiration and maybe even a new perspective to carry with you.
If you enjoyed today's episode, don't forget to hit that like button, follow us for more, and leave a comment. We'd love to hear your thoughts.
And if you're feeling generous, please take a moment to rate and review the podcast. Your support helps us reach more Spoonies just like you.
Until next time, remember to take care of yourself and keep finding strength in your story. Bye for now.
And see you next time on Spoonful of Strength.